Thank you everyone for being a part of this third in the series of events around COVID and COVID-19. We started in September with our first about going back to school and what it felt like, as it was kind of hectic in September when we started these town hall sessions. And then October, we kind of looked at the status quo and what the science was saying and how people were feeling, kind of reading the temperature. And here we are at our third town hall session. And the hot topic is all about children and the vaccines. So we had three very distinct sessions, some overlapping definitely for sure. And but we really wanted to focus each month on the items or the things that were in the news and highlighted. So we're very delighted to have you here with us tonight and to hear and to have our speakers, to hear from them and to share their expertise, their know-how, their knowledge, and what's happening on the ground. Now, we are currently waiting for one of our speakers, our speaker to the initial speaker to kick it off, and that's Dr. Carrin, Dr. Lionel Carrin. We're very pleased today to know that he was able to make it, and I know that he will be joining shortly because he did mention, he noted about 2 hours ago that he would be able to join us tonight. But we're also very pleased to have with us our panelists and speakers who will be sharing their knowledge, their expertise with us on a panel discussion tonight. We have Adam Hassan, who is a fifth-year PhD student in immunology and microbiology at McGill University. And I want to say thank you so much for jumping on board and being a part of this session tonight. Thank you, Adam. We also have Dr. Carrin Laliberte, who is a pediatrician and is in the know, right? We're talking about children and in the know about how we can speak with the kids and what's happening with our kids and the vaccine and how, what her experience is in that area. We also have Dr. Richard Costner, who is a psychologist. He's at McGill University. He does behavioral, which is quite interesting, getting to know the human and how they think, how they react, how they feel, and his role in these past three sessions has been about, what kind of conversations we can have around the vaccine and what it means to people, and understanding how different people feel about this vaccine that, seemingly has been, it would seem that it was done just in some instances over a short period of time, but it's actually something that's been in the works for, I think, more than 20 years in different places, in different ways. Last but not least, our next speaker is Sita Ramdas, who's been in healthcare and healthcare communications for over 20 years and is very much engaged in patient advocacy, among other roles that she's undertaken over years. She's a communicator, and you need that in the healthcare system, right? When you have research and you have doctors, you need someone to communicate the science so that everyone can understand it. So I want to thank you all for being a part of this. Before I begin, I'd also want to recognize and thank Sophia Sidlikowski, who is our youth outreach officer here at the Jamaica Association, and Omar Ramos, who's not here with us. He had a last-minute event, but he is our representative for the youth branch of the Jamaica Association. So I'd like to say a little bit about the Jamaica Association. We're almost 60 years young. We're 59 years this year. And we've been in the city in Montreal since 1962 and, in many different capacities. So we started off as a social club and over the years grew into many different aspects. So definitely we still have our social aspect, but we have a lot of different programs surrounding families, surrounding single women. We have a food bank, we have activities for kids. And so part of the things that we do is also this outreach to community. And in this COVID pandemic, we've been very much engaged in the education and knowledge, sharing knowledge and expertise, and hence the folks that we have tonight. So with that, I want to say perhaps what we'll do is we will start the session, and we will then introduce Dr. Karma when he is able to join us. So with that, I'll turn the floor over to Sophia Sidlikowski, and I'll ask you to take from there.
Thanks, Sharon. Hi, everyone, and it's a pleasure to be here again during this third town hall. So Sharon already gave you a glimpse of each of the speakers and all the knowledge and insightful experiences they're going to bring to the discussion tonight, and we're very looking forward to engaging with you too. Just a reminder, maybe for all the speakers, to try and speak slowly for our interpreter this evening. And without further ado, I'm going to officially introduce Adam Hassan, who is a fifth-year PhD candidate in microbiology and immunology at McGill University. He obtained his Bachelor of Science in the same department in 2017. And his current research focus lies in vaccine development for parasitic diseases using novel approaches. So welcome, Adam. And then we have Dr. Carrin Laliberte. Dr. Laliberte is a fourth-year general pediatrics resident at the University of Sherbrooke, and she'll be graduating this year. She obtained her medical diploma at the University of Ottawa in 2018 in the Francophone program. She has participated in many research projects in Ottawa and Sherbrooke over the past 10 years, including her involvement in the implementation of the Monarch Centre for Early Maternal and Newborn Care in Ottawa. And she has an interest in preventative medicine and screening programs. So for this next portion, Adam and Dr. Laliberte we're going to have a bit of like a moderated discussion for the next 15 minutes. I prepared a few questions for you both, and then we'll open the floor to questions from the audience. You can feel free to type your questions in the chat, or just unmute yourself and ask your questions after. So welcome, Dr. Laliberte and Adam. Thank you so much for being here this evening. Maybe we'll start with just a kind of general question to situate ourselves with, it's been a lot of talk in the news about the vaccination now being available to children aged 5 to 11. So Adam, we'll start with you. Can you tell us about the current risk of COVID-19 infection in children?
Yeah, hi everybody, happy to be here. So I know that originally COVID-19 infection was pretty understated in younger age groups, especially children. But as we are seeing more and more vaccination uptake in older individuals, the current age group that has the highest incidence of COVID-19 is children currently, where we see, according to a recent report from NACI, the National Association, the Advisory Committee on Immunizations, that about 8% of COVID-19 cases as of early November are in the age group of 5 to 11 years old. And on top of COVID-19 infection, while children are at diminished risk of under about 1% of contracting severe disease or death, there are many other complications that come with COVID-19 infection, which I'm sure Dr. Laliberte can expand on, such as multi-inflammatory syndrome, as well as all these symptoms that we've been hearing over the news over the course of the last 18 months concerning long COVID and other debilitating factors that are associated with the disease.
Thank you. Yeah, Dr. Laliberte, do you want to add anything to that about these side effects? Yeah.
Yeah, so it is true that we're seeing more and more kids with COVID and class exclusions and things like that. And one of the things there, like Adam said, the proportion being hospitalized are quite low. It's under 1%. But the ones that are hospitalized are often hospitalized in the ICU, in the intensive care unit, and do require sometimes intubation or some respiratory support. And so the children that we do see in hospital are quite sick. And like Adam said, one of the most severe manifestations we see is a few weeks after COVID, actually, when they present in the ICU with the multi-system inflammatory syndrome, and that's when they can be quite sick. So we have been seeing more of that since this fall, since return to school. But it is true that most of them do very well and don't have very many symptoms of COVID, like a big majority, but the ones that we do see are quite sick.
Okay, thank you. And how, so now the vaccine is available for children aged 5 to 11, is it the same vaccines that adults get? Is it different? Can you tell us what is the difference between the vaccines that kids are getting now and adults for the mRNA vaccine? Yeah, Adam, maybe?
Yeah, I could touch on this. So the vaccine is slightly different in terms of dosage for children. It is the same pre-stabilized form of the spike protein given via an mRNA formulation of the pre-stabilized spike protein of the coronavirus. But the dose is different. So instead of receiving 30 micrograms in the adult version of the dosage in ages 12 and up, it is a third of that for the age group of 5 to 11, where the children are receiving 10 micrograms and a smaller volume and a smaller needle as well.
Okay, thank you. And because I imagine I'm not a parent myself, but I guess I've put myself in the shoes of parents, and I'm wondering if parents have had questions about vaccine side effects. Maybe Dr. Laliberte, can you tell us a bit about your experience with parents' concerns about the vaccine and what side effects can be expected?
Sure. Yeah, so we have had parents starting to ask us more and more questions. I would say it went pretty well for like the age group 12 and up. When we saw them this summer, most of them were already vaccinated. They didn't have too many questions or concerns. I would say the concerns that come up the most are the complications that we're seeing in adults, like the deep vein thrombosis, so the clotting. Some had also questions about the heart disease, so the myocarditis or the pericarditis, which is like inflammation of like the tissue surrounding the heart. So those are the main concerns we get as clinicians. But in reality, the complications we do see are mostly the same as the ones that are seen in other vaccines that are given. So they're mostly local complications. So mostly like pain at the site of injections for a few days after. Sometimes they can get a bit of a fever after as well. And other than that, they can sometimes after a few doses, they can also get kind of headaches, a bit of nausea. I would say those are the most frequent ones that we do get. But it is also to note though that the group that was examined for the Pfizer vaccine, the one that was approved, it was only about 1,500 children, so of 5 to 11 years old. So it's not a very big group, but the data we do have so far was quite reassuring, and there was no cases of like the heart inflammation in those 1,500 children that were studied. And other than that, I would say most of the complications we see or that were reported were for the adolescents, and they're similar to what I just said. So mostly local kind of a bit of inflammation, a bit of headache, a bit of fever. But all in all, you can prepare your children as for any other vaccine that they would receive.
Okay. So that was going to be my next question. Like how can parents talk to their children about getting this vaccine? And how can we reassure parents?
Yeah, so I think it's hard for a lot of parents to bring them for their children for any vaccines, but we do recommend that parents kind of talk to them beforehand and kind of bring it up before, so it's not a surprise, because that's often when we get kind of a little freak out or breakdowns at the clinic. So what we usually suggest is to bring it up earlier, and the strategies that we usually recommend, we can ask the child kind of what they want to bring themselves to distract them. So either it's a toy, either it's a book, some like to watch a TV show or a song. So those are things that we often see that help distract them. And it's also important for the parent to themselves kind of be relaxed and calm before the appointment and during as well. And you can always often take the child in your arms and be kind of very comforting, take deep breaths. Those are the things that work well for that kind of 5 to 11-year-old age group. And for those who are very afraid of needles and who are very afraid of the pain, one of the things we can suggest is you can buy patches of kind of a local, it's a cream that you can apply to the arm where you'll get the vaccine. 30 minutes to 1 hour before the vaccine, you can apply it to your child's arm. That way it kind of just freezes the skin a little bit. And that can help also a little bit for the pain just for when the needle goes in. But we do suggest that people tell their children that they'll get a medication or a medicine in their arm, that it might be painful, that some children find that it goes well, some children find it a bit more difficult, but to tell them beforehand and have a discussion so it goes smoother during the appointment. So those are the main things. And I would say, I think lots of the children are already aware of the COVID, and often they even talk to us about it. So they're quite aware of what's been going on for the last 1.5 years, 2 years, and they kind of know that it's important to be able to go to their sports and their activities and go to parties with friends and to see their grandparents. So I think that's also maybe something that should be brought up when parents talk to their child about why they're getting the vaccine.
Great, thank you. Adam, a question for you. Maybe can you run us through the vaccine schedule? Is the interval the same as for adults? And I know you have some knowledge about the booster vaccines that are now available to some seniors, but for now for kids, is it just 2 doses, or how what's the schedule like?
Yes, so to my knowledge, currently Health Canada has approved the Pfizer vaccine as a 2-dose vaccine for 5 to 11-year-olds. And they have approved it as a 3 to 4 week interval as seen in the States, but the current recommendation is to wait 8 weeks in between doses, kind of like how we had in Quebec this past summer and spring. So, and in terms of boosters, I know, just as an example for adults, if we end up having to get boosters as well, is that in the United States, for example, where they had the doses so close to each other, like the first 2 doses were 3 to 4 weeks to each other, this often could act as a primary immunization. So in the field of immunology, usually we say 1 dose is to kind of get your immune system ready, experience, but then at the 2nd dose is when the immune system really takes off, and that leads to long-lived and very long-term responses. So the boosters are now a subject, especially in the US and Israel, where they had the first 2 doses so close to each other where they almost acted as a primary immunization, and now the 3rd dose is acting as more of that second exposure to have a very long-term response. In Quebec, where we had at minimum 8 weeks in between doses, and for healthcare professionals and others where it was about even longer, up to 4 months between doses. It's still unclear whether or not we will have boosters, I believe, in those populations, except for in elderly populations or more at-risk populations. I'm sure Dr. Laliberte could just correct me if I said anything wrong.
Yeah, no, for now it's 8 weeks apart for the children 5 to 11, and the third dose will be recommended for the patients with certain medical conditions that are kind of immunocompromised, so have known medical conditions, but that will be case by case, and the specialists or pediatricians following those children will let them know if they need a third dose.
Great. And are there any children who should not get the vaccine?
For now, there are no true contraindications. The only real contraindication would be if there was a anaphylactic reaction, so a severe allergic reaction to the vaccine or one of its components before. However, like the solution the vaccine is in is the one that's used for other vaccines. So if your child tolerated well their other normal schedule vaccines, there should be no problem, and those are extremely rare. So for now, there's no contraindications that are known.
Okay, great. Well, thank you both very much. I'd like to maybe open the floor to the audience. Does anyone have any questions for Adam, for Dr. Laliberte?
I may have one small question.
I have a question.
Yes. Was that Sue or
Edward
sorry.
can go first.
Yeah, okay, thank you. This is a question to Adam and to Dr. Laliberte. Some parents hesitate to get their children vaccinated because they think that children are not so affected by the disease, as you mentioned, and why are they going to expose their children to the vaccine, although the side effects are minor? So what do you give as an answer to this type of idea?
Yeah, that's one of the questions we do get a lot. So it is true, like you said, most children who get COVID, like 99% and more, don't need to be hospitalized and they don't have a severe disease. That's true. But like I said, the small percentage who are hospitalized are quite severe. So what we tell parents to kind of look at is kind of the risk versus benefit. So the risk of the vaccine right now seems to be lower than the risk of having a severe COVID disease. It's sure that it's not the same as an elderly person, for example, but the risk is still there. And like I said, I have seen a few children who were in, who had to be admitted to the ICU. So the intensive care unit needed to be intubated and needed some life support because of their COVID infection. So it's not a very big risk, like the proportion, but the proportion who are sick are very sick. So it's kind of that you need to take into account. Whereas the complications of the vaccine, like I said, are quite mild, are more localized pain, joint pain, muscle pain. So you have to kind of consider that. And I think it's also, as a parent, if you have elderly members in your community that your children see, or if they are with other children who have chronic diseases or are at risk, I think those are good reasons to get them vaccinated.
Very good, thank you. So there is some solidarity aspect to get the children vaccinated, because we can diminish the exposure of other peoples to other people to the disease, I think. Yeah?
Exactly, because the children are, like we said, kind of one of the highest percentage right now who do contract COVID, and they're quite a large percent of the people who transmit them as well. So it's to kind of protect other elderly or immunocompromised patients in their surroundings.
Very good, thank you.
Yes, Sue, did you want to ask your question?
Okay, yeah, a quick question.
Yeah.
I think it was Dr. Liberté. You mentioned that the vaccine had been tested on 15,000 children?
1,500.
1,500? Okay, and
That's
do
the
you know?
study that we have. That's the study
That's-
that the Pfizer biotech released. And so like the data that we do have, it's not on a very big cohort of children. But if you want more details on it, on the Canadian Pediatric Society website, they kind of explain the study that was done on those children and the complications, but they are still following those children for the next 2 years to see what the outcomes will be in the next 2 years, since it's quite recent.
All right, thank you.
There was one quick question in the chat, I think from Florence. I think it's maybe for Carrin, for Dr. Laliberte. Do you see that children mirror their parents' anxieties about vaccines? If a parent is nervous, then the kid is too. Does that happen?
Yes, very often. Or if another child, like a sibling, also has anxiety, often it will reflect on the child. And often, like most in that age group, like the 5 to 11 years old, they often mirror a lot what their parents how they are in the healthcare system and how they're at medical appointments. I would say in adolescence, like the 12 and older group, we saw some parents and teenagers who didn't have the same opinion. So we see more discrepancies there. But in the 5 to 11-year-olds, they do look up to their parents quite a bit, or to the people in their family. So that's why we recommend to be very calm when you go for the vaccine appointment, and try to distract them as well.
Thank you. Thank you, Adam and Carrin. This has been, a great discussion so far. I think I'll pass the floor back to Sharon, who's going to officially introduce our next speaker who just joined us, Dr. Carrin. So I'll pass it on to Sharon.
Thank you so much, Sophia, and thank you both, Adam and Carrin, for your insightful conversation and discussion. It's something to talk about the children and understanding how, this kind of uncharted territory, if you will. Not so much uncharted, but with COVID, it is uncharted territory. Thank you so much. And I want to take this, I am so pleased to have with us Dr. Lionel Carrin with us tonight. Very ecstatic that you joined us to have discussion on COVID, and particularly around children. So here I will read your bio, and then we'll open the floor to you to your discourse. So before becoming the Minister for Health and Social Services of Quebec, Lionel Carrin practiced as a pediatric neurologist and was the Director of Neurology at the Saint-Justine CHU. The author of over 100 scientific publications, mainly focused on epilepsy. He has seen his contribution recognized by many peer groups. Lionel Carrin studied at Université de Montréal, McGill University, and Harvard University, deeply involved in the community. He took part in many projects and participated in humanitarian missions in Haiti, Mali, and Vietnam. He is now entering the political fray to put his competence to the service of the people of the province. With that, I thank you, and I leave the floor to you.
Well, thank you very much, Sharon.
Thank you.
I see my cheerleader, Sita. Thank you very much. And thank you, everybody, for being here tonight. So I wanted to talk to you about our efforts to get children vaccinated in Quebec. I think it's a significant effort, especially, but I think we have to say that, first of all of Quebec has done very, very well with the vaccination program. We do have one of the highest vaccination rate around the world, first dose, second dose. And I think that has helped tremendously. As we look around either in Europe or in the US, I think we're seeing the start of the fifth wave, which is a bit scary for everyone. But I think things still look very good for us because of the way that the population has contributed to the vaccination efforts. We've started to do the third dose with the with elderly population. We're down to 70-year-olds and plus, and we're actively pushing public health to increase the third dose to other elderly people, and also to one population that we haven't talked about much is the medical population, the medical workforce, which actually got vaccinated their first and second dose quite early, and I think a third dose is probably due. Most of my former colleagues in the US have received their third dose, so we're pushing for that. And I think the safety of the vaccine, and which is a bit of a concern to all of us, and maybe even more to some of our communities. I think that now after all the vaccination that has been done around the world, we're pretty convinced that we have two very good vaccines. And I think that the pediatric formulation, I'm sure Dr. Laliberte, I think, was talking before me, told you all that the data from children is even stronger, with smaller dosages, better immune response, minimal adverse events, and even the cardiac myocarditis profile is I would say more with the disease itself than with the vaccination. So I think it's a very safe and good vaccine for our children. Obviously, I think with children, there's more concern about going for the vaccine because of the low complication rate in children. But we all have to realize that if we want this to end at some point, the more people we get immunized, the better we'll be off, and the sooner we can turn the page with all the restrictions that we have. Well, I think the example that we all follow is of the other pandemic that we know of is the Spanish flu, and that lasted 2 years. So if we want to do a little better with all the vaccines that we have, I think the sooner we get people vaccinated, the children, at least the 5 to 11 years old, I think will be a great progress for us and for everybody. There's also some questions about, the 11-year-olds and the 10-year-olds. Should they get the pediatric version or the adult version when they turn 12? I think what's recommended is that they do use the pediatric dose, and for their second shot, they go on to the 12 and above dose. And as far as I heard some concern about, parental issues, I think the avenue that our government has gone forward is that, parents have to decide. We'll provide them with all the information that's required, and we'll let them decide. We realize that it's a very personal issue, even more than for adults, and we'll live with the numbers that we get. But the early start of the vaccination program has been very, very successful, and we hope we continue rolling out to different schools. There's been some issues providing vaccinations at school or with our transport from school to the centers, but we're sorting this out with the education ministry to make it as easy as possible for every Quebecer. So this is what I had to say, but I'll be happy to answer any of your questions. concerning the vaccine or other health issues. Thank you very much.
Thank you. Thank you. Any questions? You know, I noticed that I believe Nana Graves had mentioned something, and I see that I think Laverne has a question as well. So we're going to come to you, Laverne. But we had Nana Graves who said we can also add the comparison to the flu vaccine, which we give to adults and children, same dose for decades. So probably that was relating to the fact that there was a difference in the dosage we're talking about for kids and adults. And can you talk a little bit about that? Why is there like that difference between the flu and the flu vaccine, where there's same dosage, and in COVID where there's a little bit of a difference here?
Okay, well, I don't know. I don't know about the flu vaccine. It's a small proportion of children, I think, that receive the flu vaccine.
Mm-hmm.
But for the COVID is because the immune response seems to be very strong in children. And with a smaller dose, the response seems to be very significant. So all the studies seems to show that with the reduced amount of mRNA, the immune response seems to be robust and prolonged. So
Mm-hmm.
I think it's a good way to go to give smaller dosages.
Okay, fantastic. Laverne, I believe you had a question.
Yeah, I wanted to know if children have sickle cell anemia or ulcerative colitis, would it be good for them to get the vaccine?
Yes, I think that we've, at least in the adults, people at risk were prioritized. For now, for children, we haven't given any priority levels. I mean, it's really open to everybody, but I think I would recommend if you have any, chronic disease underneath, chronic disease.
Mm-hmm. Okay.
And then excuse me, another thing, people don't really know, even these are doctors, they don't really know if this is really safe. It's just but what they're told.
No, I think the data shows that it is safe. Of course, you don't have any long-term experience because it's a new type of vaccine, which is why we're not pushing people to get the vaccine, especially because we're talking about children. But with the adults, we now have more than a year of experience. And the data in children seems to be safer, and children are used to getting vaccinated. I mean, it's been going on for years and years and years. They get shots all the time.
One other question I have is, isn't it a Canadian Constitution right that we don't have to get vaccinated if we don't want?
I'm not a constitutional lawyer, but I don't think we're forcing anybody to get vaccinated.
Mm-hmm.
I think a lot of people are.
It's been a huge issue with the medical community, but we decided to even for them, we've decided to not to enforce vaccination. Although to get through medical school, I had to get all my vaccines and all my shots. So we.
I have a question around Laverne. That's an interesting point that Dr. Carmel has brought up around the number of medical practitioners that are not yet vaccinated, and I think that number is quite low. And do you have some kind of idea around what that? There's pushback. We saw that a lot in the news. However, can you give us an idea of what that percentage looks like, what that feels like, and how those that have been vaccinated, what those numbers look like as well, to kind of see if
It varies from 2 to 5% of the medical nursing hospital force, and the numbers are lowest for physicians and nurses, and highest for the people who are working in the hospital, but not in close relationship to the patients.
Mm-hmm. All right. So most medical professionals or those within hospital settings are vaccinated and are, so it's really, I think perhaps what Laverne is pointing to is also the fact that there was a lot of news around those who weren't vaccinated and the timelines that were given for people to be vaccinated. But essentially, a good percentage, a very high percentage rather, of medical practitioners and those in hospitals are vaccinated. So there's that level of assurance that most people, when going into, or the larger percentage of people going into the hospitals, are not being exposed to COVID by medical professionals, right? There's just a smaller percentage, if you will.
Exactly, but the problem is that the medical workforce in Quebec is more than 300,000 people. So even 2% of that is like 6,000 people. So
right.
That's why at some point we decided that, you know, we would rather test them 3 times a week than lose this workforce.
And
that
that's
well, the college tells us that 99% of the doctors in Quebec have been vaccinated. 99%. So that's very good.
Oh, it's amazing. I mean, the whole population is amazing. I mean, look at other countries, other provinces. I mean, we're doing great in Quebec.
Right.
And that's why, you know, we today they gave us the economic results of this year. And the reason why we were able to have better results is because we're able to restart the economy. The reason we're able to restart the economy is because people can go out, people are vaccinated, we feel safe. So it's a tribute to all Quebecers.
Yes.
Excuse me, we are being forced into it because if you're not vaccinated, you can't go to the restaurant, you can't go to the gyms, you can't travel. So we are being forced into it. And we should have the right to say yes or no, or we should have the right to go to a restaurant, even if we're not vaccinated. I mean, I'm vaccinated now, but I was against it. I'm still against vaccination. And I just find that we're being forced into it.
Well,
and like I said, we can't go any place without it, which is wrong, because they're taking it into their own hands to say what we could do and what we can't do. Government is saying that.
Well, it's the choice to go to the restaurant or to go to movies or to travel.
Yeah, but we can't go without a vaccine passport, and that's wrong. We should still be able to go, you know?
Well, you know,
I agree with you on
everybody go there and infect people.
I think
doesn't mean just because you have just because if you're not vaccinated doesn't mean you're going to infect everybody. I have a cough, I have asthma, and I cough a lot, and the people look at me like, you know, like as if to say I have COVID. But what did people do before the COVID? They still coughed, you know. But now it's like cough, and everybody's looking like, oh, she must have COVID. You know, like it's ridiculous.
But you know, Laverne, it is we're living a reality that we have not lived before. And it is something that we as a collective are really mindful. So it's, yes, prior to COVID, we didn't have the same concerns, but with COVID, it changes the whole reality because we see the impacts. We know of individuals who've suffered from COVID, who have unfortunately passed away as a result of COVID, or have continued to have debilitating complications as a result of COVID. So it's only natural, I believe, that people will have those reactions because they are concerned and they don't know enough. So we've stepped into a whole new reality and a whole new world. And it may seem in some instances that it is it's forced, but it's not, because as Dr. Carrin said, the government has been encouraging people and there's been long campaigns, and we've been in this for now almost 2 years, going into 2 years. So we understand the science, we understand the realities, and most of the population has taken on that want to take the vaccine and have taken the vaccine. But this is the reason why part of the reason why we're having the town hall is really to continue that education, to continue the discussion, to continue the outreach to those who may have who do have concerns about the vaccine. So I think the government has not taken a draconian step to say everybody line up and you're going to get the jab in the arm. It is really a conversation piece that's happened for the last 2 years as a result. So thank you so much, Laverne, for your questions and your concerns and your input. Before Dr. Carrin, we have another question for you. And this is around the fact that we're having Christmas. Christmas is soon. And but as the individual says, maybe you can't answer this yet, but do you expect a rise in cases within the Christmas break and or a rise in the restrictions for gathering like we had last year to counter that? So I'd love to hear that.
Okay, so there's two things happening now. There's actually a rise going on right now because we know we're spending more times indoors, more contact as well. And the peak of infections in the 5 to 11-year-old, which is really increasing. And on the counterpart, we have all these kids that getting their first dose, and hopefully things will balance out. Up to now, as of this week, Public Health did not want to make any predictions about Christmas gatherings, holiday gatherings, but we hope to have an answer very soon for you. So we're hoping that within a couple of weeks we'll get a better sense on which way things are going and what we can afford to do or not over the Christmas holidays, the holidays.
Fantastic.
That's all I can say.
Let's hope. Yeah, let's hope for a good Christmas and we can do the things, Well,
absolutely.
Thank you so much. It's a tough place to be in, tough decisions that are being made, but important decisions nonetheless, so that the collective, all individuals within this province can feel protected, can feel safe, which is really important as we move through this pandemic. And hopefully by next year, we'll see brighter sides and coming through this pandemic like they did with the Spanish flu in 2 years. Let's hope that we could beat the 2-year mark of the Spanish flu.
It's too late.
It's too late? All right.
No, 2 years will be in March, so we have to stop this
before March. Sita, I see you have a question.
Yeah, I had a comment. I just wanted to say, the data is also showing that marginalized populations, vulnerable populations, which include many members of our community, who are facing health equities in their sociocultural context, in their socioeconomic context. They're in high risk categories for getting COVID. And I think that, we're fortunate that we're in a province that this vaccine is being given to us for free. And it's an equitable move because everybody in every community is being offered this vaccine for free, and it's being delivered by healthcare professionals. And we have a lot of information and strong science behind it. And so I think it's a great opportunity that we have to protect ourselves as a vulnerable community, because other parts of the planet don't have this kind of offering for protection. And, people are dying unnecessarily and are being put in really high risk situations unnecessarily. So while we can get it for free, delivered by professionals, healthcare professionals, and it's across the province, I think that we're fortunate. So I appreciate it. Just want to say thanks.
Yes, and I would reinforce this by saying that a lot of the risk factors, especially for the younger adults, include diabetes, hypertension, and being overweight, which is maybe more common in our community. So we have to be very careful. And some of the bigger things that I think that we've learned, and that hopefully will continue after the pandemic, is that when we're sick, we have to protect ourselves and protect the others. Going to work when we're sick is not necessarily a good idea, which I was the first to do before, as a doctor. So I think there's some things that we've learned that we need to continue doing after the pandemic as well. I mean, the Asians have been doing it for years, wear mask in the plane and when they're sick. So I think some of the things we have to keep doing even after the pandemic is gone.
Thank you so much, Dr. Carrin. Really appreciate your time and your input. And, you know, our town halls have been made up of many different speakers. And at this time, I'd like to turn the floor to Sophia, who will be introducing Dr. Richard Costner, who talks about behavioral components, the psychology of the vaccine, and speaking with individuals about this vaccine. So thank you so much, Dr. Carmel, for your time. And I hope that you can stay. I know that you had busy days, but love if you can stay, and if not, the recording will be available.
Thank you very much for the
Thank
invitation.
you.
Thank you. Don't hesitate if you need to talk about something else. Always a pleasure, especially about the kids. I love talking about the kids.
Thank you so much.
Bye-bye.
Thank you. Bye-bye. Thank you.
Thank
Sophia,
you,
I turn the floor.
Great. So we're lucky to have Dr. Costner with us. He's been at all of our town halls, and he is a professor of psychology at McGill University. He completed his PhD at the University of Rochester and a postdoc fellowship at Harvard University. Dr. Costner is the founder and director of the McGill Human Motivation Lab, and he has published over 200 scientific articles. He has recently won the Canadian Psychology Association's Donald O. Hebb Award for Distinguished Contributions to Psychology as a Science in 2021. In 2007, Dr. Costner received the Canadian Psychological Association Award for Excellence in Teaching. And in 2008, he won the Principal's Prize for Excellence in Teaching at McGill. Dr. Costner is a leading proponent of self-determination theory, and his recent work focuses on the psychological effects of the COVID-19 pandemic on Black young adults. So welcome, Dr. Costner.
Thank you, Sophia. Is it okay if I use the share screen?
Yes.
Okay.
Yeah.
Let's see if I can do it then. Yes. Oops. I'm at the end instead of being at the beginning. I just want to say it was very exciting to have the Minister of Health here. I can't believe that happened. And then Laverne started asking him some questions, and he answered the questions. This is a great open house, really wonderful stuff. So I'd like to talk about motivation and psychology. And I want to first say, though, that I actually began as a child clinical psychologist, and my particular interest was working with kids between 5 and 10 years old. I really liked working with that age group. However, thinking about talking to kids 5 to 10 about getting a needle for COVID-19 is a different story. So what I want to do is talk about, I think, 2 important themes when thinking about vaccinating these younger kids and thinking about how a parent would feel, and that is responsibility and trust. So I'll be talking about those 2 themes, and I'll give you some information and then some ideas. But of course, I always want to acknowledge that parents, we all think about things differently. So the first thing I wanted to remind people, the previous speakers have already noted this, but the vaccinations in Quebec have been very successful. And that's true of the vaccinations of 12 to 17-year-olds. So I looked up the statistics today, and I was really surprised to see that 82% of 12 to 17-year-olds are fully vaccinated. And that's higher than for 18 to 40-year-olds. So that the parents who have the young kids have felt confident taking them to get vaccinated. Okay. However, they've done some surveys with parents of 5 to 11-year-olds in Quebec, and it looks like there's reason for some concern. So there's 700,000 5 to 11-year-olds. That's why you see so many kids at the park and at the bus station. There's a lot of 5 to 11-year-olds. they're getting a smaller dose. You've already heard that. What I was glad to see is that the kids are getting vaccinated at schools, but they could also be vaccinated in other places if the parents want to be there. Now, the survey results that worry me are the following. So that 42% of parents would say that now that there's a vaccine, I want my child to have it for sure. That's only 42%. Another 19% say they're pretty sure. So my guess is 60% of the parents of 5 to 11-year-olds will get their kids vaccinated without too much question, without too much hesitation. But there's 20% who are absolutely against it. There's 11% who are unsure, and there's 7% who are mildly against it. I think that adds up to 40% who are hesitant. Now, remember that 80% of adults are vaccinated. So that means that there's like 20% of adults who are vaccinated, but who do not feel comfortable having their 5 to 11-year-old vaccinated, even though they themselves had the vaccination. Now, so that the question is, why are vaccinated parents hesitating to vaccinate their young kids? Now, I'm talking about the 5 to 11-year-old, but I can tell you that the next open house that we're likely to have in February is one about vaccinating the kids who are under 5 years old, because they're planning to do that in the US. The studies are already being done. And I think the same questions we're having here, we'll have again, and there'll probably be even more parents who are reluctant to think about vaccinating the less than 5-year-olds. Now, why are parents hesitating? Now I'll talk as a parent. I have a picture here. This is me at the age of 43 when my daughter was born. My daughter, Sophie, I was really surprised. She was born at the Jewish General Hospital, which is a wonderful place to have a child. And my wife had a long labor, and then Sophie popped out, and the nurse handled her for a couple minutes, and then the nurse turned around and like handed her off to me. And I wasn't ready. I didn't think as the dad I would get to hold my daughter until like later on somehow. But he just handed Sophie to me, and I just felt like, oh my gosh, she's very heavy. This is a weight. I am now responsible for my daughter. And it was such a powerful sense that my life has changed, and I have someone else now who I have to care for. And this is going to be, my number one responsibility. 30 years later, I still feel like that. So if you're a parent, it's natural to really worry about your young kids. And I think the idea of having your 7-year-old, 9-year-old vaccinated can make you a little anxious, but it doesn't need to. So necessarily. So I wanted to get a mom's perspective because I'm only a dad, and most people, when you're thinking about kids, really trust the moms. So I have a coworker who has 2 kids, and one of them is 9 and one is 6. And so I asked her, why are people hesitating? And she said she's actually hesitating herself. And then she explained, when you listen to the public health officials, they focus on the big picture, the health of the whole community. And it's like a macro view. And the impacts that most of us and the public health officials say, we all have to get vaccinated so the whole community is vaccinated. And that's why most of us are getting vaccinated. That makes perfect sense to us, and we're willing to do that. But she explained that when it's your little girl who's only 6 years old, you don't necessarily take the decision in terms of the whole population. You don't take the macro view. We're so caught up in protecting our child and like thinking about things maybe differently than we usually do. And I think that's the challenge. That's why 20% of people who are themselves vaccinated and who believe that's the right thing to do are still hesitating. And I'd like to kind of suggest some things we can think about that might lead us to reconsider, although of course it's the parents' own decision. And we even heard the minister say that they don't want to force anyone to do anything. And you've heard the doctors say it is true that young children are at less risk for the more serious cases. There's still some risk. Now, what I think the way to work through this, if you're one of the 20% who were vaccinated yourselves, is to think about how much you've already decided to do in terms of vaccinations. So that I looked this up today. My daughter is 19 years old, and my wife and I have agreed to 16 different vaccines: diphtheria, tetanus, poliovirus, and we did not question for a second not giving these. And we're so grateful we did, because when my daughter was in high school, there was an incident where another student at another school got meningitis and died. It was a tragic thing. And then we were worried. Oh my gosh, did we get that vaccine? But we were lucky. We had that vaccine too. So there are rare events that can be quite tragic. So we've already agreed to many vaccines. I think what's happened though is this is a new one. It came on suddenly, and everyone's worried, oh, we don't know enough. But actually we do know a lot now, because there's been 3 billion people who've been vaccinated. And we also know from the science of vaccines that it's surpassingly unlikely that there'll be a side effect that only emerges a year from now or 2 years from now. That's never happened with vaccines. So I think most serious, reliable health authorities would say, we can trust these vaccines. Now, the other thing that I think is good to think about is that there's kind of a logical fallacy that we fall into in our everyday lives about responsibility. We feel most responsible for actions we take, for decisions we make, for things we do. But in fact, we're also responsible for things we don't do, for actions we do not take. And, we know this. I have high blood pressure now. I have high cholesterol. And it's because I didn't watch my diet as well as I should have. And all of us in our own lives know that what will happen to us is a result of the actions we take and the actions we don't take. And there's a lot of evidence that not getting the vaccine puts our kids at very high risk. And in fact, right now, I think children are the major vector of transmission for COVID-19. And some of them, like we heard from the doctor, if they go to the hospital, it's very serious. And my understanding is about 10% of kids, like 10% of adults, have long cases of COVID where they have some continuing symptoms. So I think it's good to stop and think about those kinds of things. So there's a responsibility to think about our actions. We take it very seriously, but we also have to realize we're responsible for inaction. And if we don't get a vaccine and then our child catches COVID, and if it's a serious case, we would feel responsible and we'd feel terrible. And the doctors have judged that there's less risk of bad outcomes associated with getting the vaccine than with not getting it. Now, the question is, do you trust the doctors? Do you trust the public health minister who spoke to us? Do you trust the premier? Do you trust the doctors and nurses? And there's individual differences and there's community differences. Black communities trust medical authorities less, and there's a reason for that. There's some terrible things that happened historically with terrible experiments done on Black men, for example. There's also everyone in this audience, not me, because I'm not Black, but every Black person in this audience knows that Black people are often treated differently when they go to the emergency room, so that you may have to wait more, the doctors won't listen to you, or you'll be ignored more. There's some systemic experiences that you read about, that you experience, and that people you know have experienced. So I think there's very sensible reasons for members of the Black community to be a little bit worried. But, you know, I think what I would recommend is, well, let's really consider this. The historical cases mostly involved, unfairly using Black people to experiment on. And often what happened is Black people would be the last to receive treatments or things of that sort. This vaccination program isn't targeted at Black people. It's universal. All the white doctors are having their kids vaccinated. 99% of the doctors are vaccinating themselves. So that it's not as if the medical authorities are saying, okay, the Black community, people of color should do this. They're telling everyone to do that. And I think that suggests that there's a good faith belief from the medical authorities that vaccinations work. I would bet $1,000 that the health minister has his whole family vaccinated, his whole extended family, and all the ministers do, so that they're not hiding something from us. Okay. Now, the last thing I want to talk about is when I spoke with my student, she has a 9-year-old and a 6-year-old. And what you'll find is some kids are excited to be vaccinated. Her 9-year-old boy jumped up and down. He said, finally, finally, I'm tired. I'm sick and tired of worrying about COVID-19 and hearing about it. And I'm upset that I've had to miss activities. I've had social events canceled. My life has not been what it could be. And he wanted to get vaccinated like in the next 10 minutes. And he's already been vaccinated. Now, the tricky thing is that the 6-year-old girl, she's a little needle phobic. And she told my colleague, I'm not sure, Mom. I don't really want to be vaccinated. And here the challenge is, what do you do as a parent? And I would suggest, think about what do you do if your child says, well, they don't want the measles vaccine, or if they say they don't want to brush their teeth, or if they say they don't want to go to sleep at 12 o'clock. And I recommend a book. It's marvelous. I use this with my daughter. It's the only way I survived when she was in her princess stage with tantrums at the age of 4. It's How to Talk So Kids Will Listen and How to Listen So Kids Will Talk. And the idea is you focus on the child's emotions and feelings, but then you set limits and you set boundaries and you set rules because you're the parent and because you're responsible for the child in the present and in the future. So with a 6-year-old who's anxious and frightened, what you can do is say, boy, I can see you're really nervous about that vaccine. Can you tell me something about that? and they'll say, yeah, the needle's so big. And my friend, I heard a story about how a kid got it and their eyes fell out. And they'll come up with something and you'll say, well, that story's not true. The needle's not big, but it's natural to be scared. I'm a little nervous of needles too. A lot of us are. And then you say, well, so you're worried that it might hurt you in some way. And then you say, but we have to let you know that Dad and I got this vaccine and your brother got it, and you're getting a dose that's only 1/3 the size. And it's a teeny weeny little needle. It's like a tiny needle, not a big one. And we've talked to a lot of people. We have family. My brother's a chemist. I talked to him, and we know these are good for protecting you. So we've decided that all of us are going to get it. And I know you may be upset about that. And let's talk about what we could do to help you feel more comfortable. Would it help you if we went with you? If you brought your favorite toy with you? Let's talk about that, but we do have to get it. And then you always end by, I know you don't like this rule and you're probably as upset at us. So it involves setting a limit, but in an empathic way. And that helps the child understand why it's being done. They'll still be angry with you, but I think most of us will feel like we fulfilled a parental responsibility, even though it was hard. So in summary, I think it's responsibility and trust. There's a special kind of responsibility. There's nothing like it in my life and in many of your lives that you feel when they put the baby in your arms or when the baby comes out of you, if you're a woman. And you carry that your whole life. I carry it every day. So there's that responsibility. And I think it makes us extra, extra cautious. But, we also have to be reasonable. We also have to think about the evidence, and we have to think about the future and what's best. And then I do believe we have to have some trust in the medical authorities. And if you don't have that, you probably should talk to other people in your community and ask them how they've resolved that. Now, I would just say in terms of responsibility, it's the 5 to 18-year-olds who are getting COVID most frequently now. There is the collective community concern, which is that there's many other people in the community who may not even be able to get vaccinated because they have other disorders. And if our kids don't get vaccinated, they're left exposed. The other thing, I think you're all fatigued. I'm fatigued. This pandemic seems like it's been going on for 10 years. It's not even 2 years yet, but it seems so long. But just today, I heard that there's a new variant that they've identified in South Africa. There's only 10 cases, but it's not just a variant, it's a super variant. So it's not just a villain, it's a super villain. And this variant, they have to come up with a new Greek name for it. And this new variant is going to be called Nu, N-U, because that's a letter in the Greek alphabet. But the reason these variants are shifting into super status is because the virus continues to spread. And it's a worldwide problem. It's not just a Canadian problem. Quebec is doing a great job, but we have to make sure we get vaccinated, and we have to make sure that other countries and other families and other children get vaccinated too. So my own personal opinion as a parent is that the most responsible thing for me to do would be to have my 6-year-old, my 9-year-old, my 2-year-old, my 4-year-old get vaccinated. Maybe not right away, but once the public health authorities tell me, and once I talk with my pediatrician, and once I listen to like the great doctor and PhD who we heard earlier, to take the chance. And I think that's the way I would try to balance responsibility and trust. Okay, I'll stop there. Sorry. I hope I didn't go too long. I'll stop sharing. Okay.
Thank you, Dr. Costner. It's always a pleasure to have you at these town halls. Do we have any questions for Dr. Costner? A comment from Florence. Great presentation. I agree.
More questions like that. Yeah.
Yeah.
Thanks. Sita has a question, I think. Oh no.
She's clapping.
Yeah.
Clapping. I think that was a great
Yes.
presentation. And just to say that thanks for recommending that book. I think that will be helpful for a lot of parents.
Yes.
Oh, it's a wonderful book. It's so wise. What I used to do when my daughter was 4, you've probably had daughters when they were 4 years old, they think they're princesses and they have hissy fits and tantrums. I used to cut out the key summary about tantrums and put it on my refrigerator. And Sophie would explode about some like tiny little thing. And I say, Sophie, you just hold that a second. And then I'd run into the kitchen and read the guidelines of what I'm supposed to ask, how I'm supposed to respond. And, you know, she had so many tantrums that after a week, I was really good at it. And then the tantrums receded. But previous generations, parents before us have had these kinds of challenges. And there is some helpful advice for how to talk and listen. And the big mistake people always make is they think it's just listening, just empathizing. No, you need the limits, you need the rules, and you need the softness and concern and the caring, the two together. And this book actually argues the only way we can really care for and love our kids is if we do have some rules. Otherwise, they're going to drive us crazy. And they're going to run all over us. And we're going to feel so stressed. And so learning how to set these kinds of empathic limits, you know, it's the best thing I did in my education. I still had some tough times. And oh my gosh, when my daughter became a teenager, actually a preteen, that was a whole different story. But I do think it's this balance between limits and empathy. And as a parent, it's the responsibility, but also the caring. And I think we have to trust some other people too. We can't just say, well, we're going to do our own research. We're going to make up our own. How could we do research on something like this? We can't. Okay, I'll stop, I guess.
I have a quick question, if you don't mind.
Sure.
It's more like I'm not a parent or anything, but I'm wondering, like, how would you approach, parents talking to their kids about the whole pandemic thing, right? Because you mentioned, like,
no,
parents
that's wonderful.
are super protective, and I'm just wondering.
That is such an important thing, because I think the tendency we all have is to shelter our kids from things like death, illness, tragedy. And it's a really hard thing to talk about something as terrible and frightening as the pandemic. And my guess is, all of you in the Black community have had to do this much more than me, because the pandemic has hit your community and your family so hard that you can't avoid but say, our uncle has, I heard there's a NBA basketball star, a Black player, who lost 5 of his family members. I haven't heard of any NBA white basketball star who's lost even one family member, but maybe they have. So, but So I think it's a reality that we need to talk to our children about. And I think there's a way to do it without scaring the bejeebers out of them. And that's by giving factual information, by reassuring them that we're going to protect them as much as possible, and that we're going to do everything we can. But we also don't want to scare them so that they're like frightened of touching another child or going near another child. And kids pick that up pretty quickly. So it's really, we have to model kind of moderate, healthy, adaptive coping with this pandemic. And sometimes it's hard to do because some of us, we're more prone to freaking out and we're more likely to be obsessive compulsive. Actually, being obsessive compulsive during the pandemic has been a good thing. I think it's been adaptive, but it's a great question. But my guess is a lot of the ladies who are here today have had to deal with this with their kids, and they could probably speak to it better. My daughter's 20 years old, and she used to be nervous, but she's one of these teenage young adults who doesn't really think about it much and wishes it would just go away. I think it's the younger kids who might have some deeper fears about it. And oh, of course, fundamental to every young child, their greatest fear is that their parents will die. So even if they're not afraid of getting it themselves, there's a secondary fear, which is that mommy or daddy will get it. That's the deepest fear. So my daughter, actually, when she was 8, she used to have nightmares about us dying. So we would talk to her about that and how she felt about that. Why? So that's something kids have. It's especially, I think, between 8 and 10. It's a common fear. So it's a really good question, Fiona. And perhaps I should recommend that you should buy the book, How to Talk to Children so that they will listen, how to listen, because the book is just full of examples. Every single example that you can think of, they'll go through it step by step by step.
All right, will do.
Yeah.
Thank you.
I have a question. I want to know, why do you think it's a lot more Blacks are getting it?
Oh, well, my understanding is that, well, the first thing is Black people are more likely to work in frontline service kinds of positions, both even in the health system, they're on the front line. Also, in terms of the stores, where they said these stores have to keep open and people have to keep working. There's a greater percentage of Black people who work in those frontline service positions, and people of color more generally. Then the other factor is that Black communities have been neglected, and there's systemic factors that usually lead Black communities to be more overcrowded with less resources. There's also access to information. We did a study with French-speaking and English-speaking Black adults in Quebec. Actually, I didn't do this study. The Black Community Resource Center did it. We found a significant difference. So there was particularly the English-speaking Black adults who felt like they weren't getting information about COVID. They weren't getting it in a timely way. They weren't getting it in a clear way relative to the French-speaking Black communities. So to some extent, the English-speaking Black community, it's a double minority community. And, you know, I wouldn't say this if the minister were here. There's also a sense that I think most Black people have in Quebec is that the current government doesn't understand the everyday challenges that Black people face. The premier seems reluctant to acknowledge that there's systemic anti-Black racism. And in fact, the head of the Bloc Québécois, when he was asked about this, he turned it around and he said, anyone who says there's systemic racism in Quebec is actually a racist against French-speaking Quebecois. You're the racist. So that's not a good environment in which to feel confident, I think, for particularly English-speaking Black community members.
Because I know
Thank
there
you.
was somebody, woman, excuse me, that was saying that, like, you know, as far as Legault, he said there is systemic racism, and if you, you know, like, you just don't want to believe it or something like that, he was saying, you know, but it's true.
Well, that would be great if he, boy, I will check that right after this meeting. If he finally has acknowledged that there's systemic racism, that means he's moved up in the stages of change toward the correct enlightened position.
It wasn't Legault that said that. It was one of the other people. I don't remember the guy's name.
Oh, yeah. I think most of the cabinet, like I'm certain that the minister who was here tonight, well, he wouldn't want to contradict the premier, perhaps. Laverne, if he comes back again, ask him that question, whether he believes there's system. Sharon, invite the minister back again and let's get him on record.
That'll be a hard one. That'll be a hard you know. Well, I want to say thank you so much, Richard, for the conversation, and Laverne always engaging in the conversation. I really appreciate it, and the segue that you give, Richard, is just so amazing. For we're going to open it up to Sita to talk about the communication piece. When it comes to, you talked about the communication piece to, you know, to children, but we'll talk about the communication piece with from Sita's perspective. So Sita, thank you so much, Richard. It was fantastic as always. I appreciate it.
Yeah, thanks a lot.
Thanks. And I just wanted to just say two things as Sophia, if you could flip up my presentation for me, is that okay?
Yeah, absolutely.
And just to say, Dr. Costner, about your parenting skills and listening. As a West Indian mother, I was raised by West Indian parents. So our tactic is when your kids throw a tantrum, as a parent, you just throw a bigger one and you really get their attention that way too. It's worked.
Yeah. My wife does that. My wife does that and it worked for her, but that never worked for me. I have a hard time expressing anger to Sophie.
And I also just wanted to say that in terms of why Black communities seem to be more affected by COVID, it is part of my presentation, and I had said it in the previous presentation that you know, as Dr. Costner pointed out, members of the Black community a lot of them are in these frontline facing jobs where we're on the front lines, whether it is as a healthcare nurse or doctor or a teacher, but we're in direct contact with the public, or we may be working in a grocery store or in a restaurant, but we're in direct contact with people, and that exposes us a lot more to the virus or potentially picking it up. But at the same time, the Black community, that interview that you saw where François Legault said there is no systemic racism in Canada. If you look at it again, I'm actually on the back end of that interview answering him, and my question to him was, where are you getting your data from? And it's because we have to look at the evidence. Where are you getting your data that there is no systemic racism, when I've been working in healthcare for over 25 years, and I have a lot of members of the Black community because it's my community. I've grown up in Cotonou, and I've known a lot of people for over 50 years, but also other marginalized communities who can't get appointments, who can't get access to care for their children, who can't, you know, they have children that may be coming up with learning disabilities, and those have to be treated at a certain age, like at a certain time. If you don't do it on time, these kids are not going to get the help they need and will be disadvantaged for life. You know, why don't we have dedicated culturally safe elder care centers for the members of our Black community that will care for our elders in their cultural context? So these things I've been advocating for with different health ministers through my past quarter of a century working behind the scenes and dealing with this issue. And so the data is there in our experiences, but the problem we have as a community is we are reluctant to document the failures of the system towards us. We have to learn to complain more and to be more open about, hey, I didn't get my appointment on time, or I wasn't treated with respect when I went to see this clinician. You have to report these things, and there's, you know, every patient in this province is entitled to the same rights under the Quebec Health Act, and that is the right to optimal care. So you can contact me, Sharon can tell you how, but if you have issues, please make complaints and bring them to the attention of the government, and that'll help them to see where the systemic racist issues are occurring. I want to jump into my next slide.
Okay, I didn't officially introduce you, Sita, but I know you kind of introduced yourself, but I'm yeah, I mean, I can let you jump in. Can I briefly introduce you? Or do you want to introduce yourself?
Yeah,
Okay.
So I think a lot of people kind of are familiar
Okay.
with me through my last name. My family had, I think, probably the first West Indian store in all of Canada, which was Ramdas Foods, and I didn't really work in the store because they made sure I went to university and studied clinical psychology. But I still am very dedicated to our community on so many other levels, and I've been advocating for patients' rights for my entire career. And go to the next slide. I wanted to introduce the topic.
Sorry, give me. Sorry,
yeah, sure.
I'm just like, there's another. I know this happened last time, but I'm just gonna. Okay, there we go. Yeah.
I just want to introduce the topic from the perspective I have as a member of the community, as a child, a racialized child growing up in Quebec. And so I came from Trinidad as a really young kid. I was 7 years old, and that's the scene you're looking at is a typical Trinidadian veranda. This is something you might find in any home, really, in any of the Caribbean isles. We have open verandas, and there's a roof that covers it because we get a lot of rain, so we could still enjoy sitting out on the veranda without getting wet. And there's usually a hammock, which you see pictured there. And in the evenings, the children would generally climb into that hammock. We'd all squeeze in during as the sun was going down, and the elders might sit at the table that you see in the background, either playing cards or having a cup of tea. And another elder might be in the chair that's in the forefront. And they'd be either telling scary stories and entertaining the children with scary bedtime stories, or sometimes funny bedtime stories, or sometimes they'd be just gossiping about what the neighbor did, or talking about what some cousin did or some old auntie did. But those moments weren't just about storytelling. They were about a lot more. They were about passing on traditional knowledge and traditional cultural information to us as children. So if you go to the next slide. So growing up, I would hear, so-and-so had a terrible hangover, or so-and-so went to carnival and partied too much, or so-and-so got a terrible scrape and has a bad infection because they fell down. And, they would be mentioning like this first plant that you're seeing, that's an aloe vera plant. Now here in Canada, those aloe vera plants I've seen, they're like 6 inches tall. Those things in my island could be 6 feet tall, all right? And we learned as little kids, you get a cut, you fall down and bruise yourself, you break off a piece of that plant and you rub it on the cut, and that disinfects the cut and it starts to heal it. And we also know it to be a moisturizer, like if we have dry skin or anything like that, we would just rub that stuff on our skin. And the one in the middle is chandelier. And that one is kind of brewed as a tea. When you have cold, when you have congestion, they mush it up into a poultice and they stick it on your chest. It doesn't smell too bad, but it kind of alleviates the congestion that you might have. And then some of you might be familiar with fever grass, which is the little bundle of sticks there on the end that's wrapped up. And that's known as lemongrass in some cultures. And you brew that. And that's a very calming tea that can help you when you're coming down with a cold and flu. But it's also has anti-anxiety properties. So we give it to people that are really stressed out and strung out in our culture. But these little discussions with those elders on the veranda late in the evening was a way of passing on the traditional knowledge of healing herbs and plants to us as children. You're probably wondering, why am I telling you all this? Well, go to the next slide. Oh, that's a cool one. So you must have heard of our famous Trinidad Carnival, and there's a lot of partying and people get hungover. So this cactus is called Mojave cactus. It's also called Hedge Cactus in the islands. And in many different islands in the Caribbean, you might see this planted along the borders of your neighbor's property and your property, because it's sort of a way to divide the properties, but it's also a way to keep out any kind of trespassers. First of all, they don't want to get poked by the cactus, but it has other purposes. We can dry out the cactus and use it as a container or as a gourd, and it has a nectar in it that has some medicinal properties, and those little flowers as well. You brew that stuff up and you drink it before you go to party, and you won't get a hangover, in case you're wondering. Next slide. So these are some of the foods from my culture, and again, they're common across the Caribbean islands. You might recognize some of them, and I know how to cook them, how to prepare them. Some of them do have some medicinal value. The skin of some are used for certain healing things. The seeds are used for certain healing things. And I learned all that as a child, 7, 8 years old. And then when I came to Canada, I still had that knowledge with me. And I've been able to transmit that knowledge to my 3 children, who are all born and raised in Montreal, Quebec. They're Quebecers from birth. They're grown adults now. They're all over 18, but I've transmitted that knowledge onto them. Next slide. So I'm lucky, because we can find these things, these fruits and vegetables here in Canada. We're lucky that we can get such exotic stuff here. But my kids who never set foot on my island know all about it and how to use it for stuff. And that's my point, is our children, they are our most vulnerable community members, because they're so young, and we do everything we can to take care of them. But they are also our strongest ambassadors of our heritage and our culture, because they are the ones who carry that traditional cultural knowledge from generation to generation. And so for me, protecting each child isn't just about protecting that one individual and caring for them and ensuring they get great care. It's about protecting the heritage and the culture of our entire group and community. And these are photos of activities I did with the kids over the years. The first one depicting bringing them into the hospital, and they're looking at it's basically a mannequin that you can take apart and see inside the body, and then they had to put it back together again. And then this was at one of the local Côte de Neige events, where we celebrated what we call 5 senses and 5 continents. And the third one was at the Commission Scolaire, which is the French school board, where I was with Black Francophone children, also who are marginalized. So language does not have any impact. Skin tone has much more of an impact, because these kids too don't get access to the same sort of education, care, and opportunities. So I did these activities over the past 25 years, trying to get the kids involved, get them opportunities, let them meet professionals who could mentor them. And I want to make it clear, they're not just our most vulnerable and precious community members, but they are our ambassadors moving forward in our own heritage. Next slide, please. And as I was saying earlier, COVID-19 has done one positive thing. It has shown by the numbers, unfortunately, of people from racialized and ethnic groups dying, those high numbers, that it has had a very negative impact on those of us who come from visible minority groups and from marginalized communities. And so, having fought for so many years for equitable healthcare across racialized and marginalized communities, to see the public health system making sure that everyone has access to the vaccines and to protection, for me, is a huge and very important accomplishment. Next slide, please. Just a quick thing. I was looking at the statistics from StatsCan 2016, they had predicted that by the year 2036, people of color would be about a third of our population of Canada, but that's 2016. With COVID hitting, surely those numbers are going to be devastatingly lower. As we've seen, COVID has shown that it's unequally affecting different ethnic and racial groups. And they are probably 6 times more at risk of getting sick and dying from COVID-19, just being from a racialized community. Next slide, please. And when we look at the situation, this data is from Quebec Public Health. It's from last week. Look at the numbers. Children age 0, birth to 9 years old are about 10% of the confirmed cases. Those 10 to 19, 13%. If you look at the 70, 80, and 90-year-olds, the numbers have really gone down because they were prioritized and given the vaccine since they were the most vulnerable when the pandemic first hit. But now we see that the virus has turned its interest towards our children. Next slide, please. And that's just a graphic representation to show you in the pie chart. You see that big blue area there, and the big black area is really affecting a lot of our youth, our younger people. And if you look at the little red section and the two little turquoise sections beside it, those are the older populations which are actually faring much better now since we started looking after them right away. Well, not right away, but certainly they were the first group to get inoculated. Next slide, please. And Public Health Canada had put out a very interesting report. Again, this is last week. I found it to be very impactful that among the youth and adults between the ages of 12 to 59, unvaccinated people were 51 times more likely to be hospitalized with COVID than fully vaccinated people. And for older adults who are age 60 years plus, unvaccinated were 19 times more likely to be hospitalized. So you see, again, that the virus has seemed to now be having a bigger impact on younger people. Next slide, please. So we all know the symptom COVIDs by now. I'm not going to spend any time on that slide, but all those symptoms, fever and coughing and stuff, looks a lot like the usual winter flu that we might pick up, or the winter cough and cold. So that's going to make it very difficult for us to tell what exactly is happening when our kid comes home with a runny nose and a cough. It's going to be very difficult to tell because it's so similar to the regular cold. Next slide. But what we do know is if it happens to be COVID, the outcome can be very devastating. There's the long-term effects of COVID, which can also affect young people. For months after they recover, they can continue to have a lot of these symptoms: shortness of breath, memory and concentration issues, which will definitely impact them if they're school children, depression and anxiety on multiple levels, generally not feeling well, but also if they can't get out and socialize and be with their friends, that'll add to it. And an interesting other impact of it is people who have recovered from COVID develop diabetes. This is a new study that has shown that there's some damage that's being done to their beta cells. And so there are going to be a new generation of COVID-created diabetics out there. Next slide. I just wanted to bring your attention to some of the long-term organ damage that COVID-19 can also do in young people, the highlighted section. Even in young people, COVID-19 can cause strokes and seizures and Guillain-Barré syndrome, which is a condition that causes temporary paralysis and increase their risk of developing Parkinson's and Alzheimer's disease. Next slide. Other fallout of COVID, I'd mentioned that the last time, is the fact that our ICUs are still overwhelmed with patients. Our healthcare workers are burning out. We've been so busy and preoccupied looking after COVID patients that we've got a backlog now of routine appointments and procedures that have been canceled, and trying to reschedule those are going to be very tough. And so follow-ups with routine follow-ups for physicians are sort of like going to be a challenge because nobody has the time to schedule things on time and do the follow-ups within the tight deadlines that there should have been doing because COVID threw everything into sort of chaos. The vaccine passports themselves, we've heard some discussions and concerns this evening, are making certain people feel marginalized and excluded because if they choose not to be vaccinated, then they can't participate in certain activities. And imagine that for a child who may already be feeling, isolated and marginalized and left out, not one of the popular kids. And if they're not vaccinated and they really can't get involved with these other activities, it's a further stigma for a young child to have to bear. Next slide. Quick summary. The impact on children so far is that they represent about 16.8% of the cases, and this is related to Canada's health info base that I got the information from. There have been about 1.6 million new children cases since September when school started, interestingly enough. And for the 14th week in a row, these are from last week, by the way, the cases are above 100,000. So we're seeing an increase. I mean, this information is telling you that, things are going up, they're not going down. What's very concerning is that children with other health conditions like obesity or diabetes and asthma, or who have congenital, conditions, are much higher risk if they get this disease. There's also very concrete studies that are showing that there are disproportionately higher rates of COVID in Hispanic and non-Hispanic Black children versus in non-Hispanic white children. So again, racialized communities seem to be plagued by this plague. Next slide, please. So again, I'm not going to go over all the information on the impact because I'm mindful of the time, but it's interesting to look at the fact that the USA started vaccinating their kids, and they've done over 1 million vaccines on children that are 5 to 11 years old, and everything's been going smoothly. The vaccines for children, we took more time in the development and then the dissemination of the vaccine, and they've been through very rigorous testing, this extra testing, such as looking at the epidemiological data, vaccine effectiveness, and so on. And we also have to be mindful that the vaccine is being delivered to children by healthcare professionals who can answer questions that parents may have. We have to remember that the kids can get as infected as often as adults do, but the children tend to be asymptomatic. So they're infected, but they don't show any symptoms. So they're walking around looking fine, and they're unknowingly spreading the virus to others, such as pregnant women, to other children, some who may be health compromised, to the elderly. And I was listening to news reports just this evening before I logged on that there's been a spike in pregnant women who are getting sick from COVID, and it's quite alarming. COVID-19 is infectious before you get sick and before you're actually showing symptoms. And not vaccinating the kids means they become a transmitter of this illness. And with the holidays here and our kids going to visit our grandparents and hanging out with friends and buddies, they become a transmitter of this disease, even if they don't themselves show sickness. So getting the vaccine isn't just protecting the kid from getting it, but it's protecting the kid from giving it to other people and making other people sick. Next slide, please. Our premier said that he would be rolling out the vaccines for kids who are age 5 to 11. They're not putting pressure on parents, as Dr. Carrin said. We respect every parent's right to choose. They did a poll of parents, and 11% of the parents who were polled said they weren't sure yet. But 21% of the parents were very firm in saying that they weren't planning to get their kids vaccinated. The common thing between those who aren't sure versus those who are sure is that they aren't really worried about their kids' health. But I want to remind you, kids can still transmit the virus to other vulnerable people. And so getting a child vaccinated doesn't just give the child protection, but it is protecting other people in your community and social network. Next slide, please. And if you think that, you know, kids are at lower risk, just a reminder that the virus, which is mutating, and Dr. Costner pointed out today, there's now a super variant called Nu, the Greek letter N. That virus hangs around on a lot of different surfaces. It hangs around on glass for about 5 days, and on metal for about 5 days, and 7 days on things like elevator buttons and rails, surfaces that your kids are going to be touching all the time. Next slide, please. And in some cases, it may hang around on certain surfaces for up to 28 days. Phone screens being one of them, tablets and computers being one of them. These are all things that kids are always touching, and then touching each other, and then touching you. Next slide, please. I'm not going to go through this slide. This is just really a summary of how COVID appeared on the scene. And I think by now we're all COVID experts. I think what's important to take away from here is that there are over 30 variants, and these are increasing as we speak. Next slide. This was just a reminder that COVID is not a bacteria, it is a virus. So it's not actually a living thing, but it's rather a package of information that comes in without your permission. It'll go into your body, or it'll infect your child's body without your permission and knowledge, and take advantage of the beautiful, healthy environment of your child's body, use up all the wonderful nutrients and resources in your child's body to reproduce itself and make more of its friends, to inflict harm on others. Next slide. And so taking the vaccine is a countermeasure to that nasty little invader who comes into you or your child's body without permission, because the vaccine is really just a bunch of instructions that tells your body how to recognize COVID and then how to defeat it. So what's important to remember is that the vaccines are there to protect you by giving your body the information to fight off the virus. It's a teacher in a sense. That's what the vaccine is. So if you're talking to your children to explain to them what the vaccine is doing, I think that's a really good analogy for them to understand. It's coming in and teaching your body how to defend itself against a predator. Next slide, please. What vaccines don't do, they don't contain any live virus, which I know a lot of parents are worried about, and I'm a parent, and I can totally understand. They don't change your DNA or the way your body will work. They're just instructions on specifically fighting corona, and they don't contain any microchips that will track you. Microchips are very expensive. No government has billions of dollars to implant these in every citizen. And if any government wanted to track you, your cell phone, your car, and all the security cameras on buildings, those will track you. You don't have to worry about a microchip. Worry about your cell phone. Next slide. The thing with the vaccines is there's a lot of information made available to you through public health, through the many professionals who shared their knowledge with us here this evening, and through well-vetted and well-respected organizations, scientific organizations across the world. With that knowledge, you can make an informed decision, informed consent to take the vaccine, informed consent to not take the vaccine. What's important to remember is the virus doesn't ask for your consent when it invades your body or the body of your child. Next slide, please. And if we, as Dr. Carrin said, if we take the time to take this vaccine, we're preventing it from spreading to others. We're protecting ourselves and our community. As I'm trying to convey to you, we're not just protecting this community now, we're protecting the generations to come. And we make it harder for the virus and its variants to sustain. So it should fizzle out. It should start fizzling out if we all thought of each other and we consider taking the vaccine. Next slide, please. And I had put this in there, but Dr. Costner had beat me to it. And that was the breaking news about the COVID super variant that was reported in The Guardian today. It's 10 to 15% more transmissible. And so if you're hesitating about the vaccine, don't hesitate too long, because the virus is adapting and it's making itself stronger. So we've got to stay ahead of it. And the vaccine is what keeps us ahead of it. And we're still finding out new information, but you can protect yourself, your loved ones, and your community, and you know how. Next one, slide. Thank you very much. I'm sorry that I was speeding through this presentation, but I was trying to be mindful of everyone's time, and I thank you for being patient for me to do so. And if you have any questions, I'm happy to take them, but I encourage you to read up on the literature and don't delay. Get your children vaccinated, get yourself vaccinated.
Thank you, Sita. What a great presentation. Thank you so much for joining us. Do we have any questions? I know it's just past 9, but could take a question if anyone has any comments or questions. No?
Yeah. Yeah. I think it was as you said, Sophia, a very comprehensive presentation, a good presentation overall. I love the idea of the talking about the cultural context and bringing that into the conversation, and how that, impacts decision making, right? And that it's not just a singular decision, but it's like the community decision as well. Like how we are communal. We all are everyone, all communities are communal, but in the Caribbean and in Caribbean culture and in West Indian culture, that's definitely a strong part of how we do things and how our families integrate, from the young and the old together, especially like swinging on that veranda at night. It's a big deal in the Caribbean. It's a really big deal.
It is, and you don't have to be in that country to pass on that traditional knowledge. Like I said, the kids weren't born there, and they now have it, and they will transmit it forward. But that intergenerational passage of information only occurs when we really do everything to protect our young ones, and ensure that their safety and well-being come first. And the system has not done that for us historically. They're starting to listen to us now, and we need to take advantage of the fact that they're listening and that they're giving us the opportunity. Because imagine, last time I mentioned, if you were charging for this vaccine, it's about $20 a dose, and you might say, okay, well, I could afford the $20 if the government wanted to charge me for it. But then factor in, it's delivered by a healthcare professional that you have to pay. You have to pay for the needle that it's in. You have to pay for the transport of the vial of the thing. Coordinating your appointment, that starts to add up to big bucks. Right now, they're doing this for our communities for free, and we get the boosters and we get the follow-up for free. We need to take advantage of that.
So true. So true. Any other questions or thank you, Florence and Fiona, for your comments. Fantastic. Thank you. Any questions or comments, last comments? So I want to take this opportunity to thank everyone, and for your patience and for your engagement and your comments and conversation throughout this 2-hour town hall, the last in the series for the moment. And I think, Richard, you're right. Another town hall is due in the new year to kind of to catch up with what has happened over the Christmas holiday, as Florence pointed out in her question. What will the holidays look like, and what would the new year look like after we've lived through that, but also with the new variant, this appropriately named new variant that is 10 to 15 times more transmissible. That is something. So we gotta keep keep the faith, as they say, keep talking about it, keep questioning, and definitely going out and making the choices that make sense for us as individuals and for our community as well. So I want to say thank you so much to all of you for being here with us, for taking the time, and for all the presenters who have been with us since day one. Thank you to the DRSP as well. I see Dr. Desiree is here. I know that Florence is here. Thank you all for your involvement and your commitment to this effort. And with that, I want to wish you all a very wonderful evening. Thank you so much.